Good morning. Welcome back to Open Med School. This part of series of lectures on rheumatology. Today I'll be discussing internal medicine competency 7.3 to 7.9. This is based on Davidson's and Harrison's principles of internal medicine. So, joint pain is causes clinical approach pathophysiology. That is the basis of the content of the lectures. So objectives are to classify joint pains as acute, subacute and chronic depending upon the duration, differentiate between arthritis and arthralgia, also inflammatory versus mechanical pain, to distinguish between articular and periarticular pain, and some of the features of rheumatological diseases. We'll discuss few words on viral arthritis including dengue and chikungunya, and at the end there will be case-based approach with MCQs and question answers. So this is the objective of the session. So now we go to the classification of arthritis. Classification can be based on the duration. That is one we'll be discussing first. So the based on duration is divided into acute. Acute means the duration is less than 6 weeks. The classical examples are gout, septic arthritis, trauma, and other crystal-induced arthritis like calcium pyrophosphate. Subacute means 6 weeks to 3 months, and chronic is more than 3 months. The subacute ones, the viral arthritis and reactive arthritis, can extend up to 3 months. And the chronic one, the classical one, is the rheumatoid arthritis, osteoarthritis, and the spondyloarthritis. So remember, you divide the arthritis into acute arthritis, subacute arthritis, and chronic arthritis. Acute, the important ones we have already mentioned, the pyogenic abscess or the septic arthritis, and sometimes hemophilia can also produce a sudden onset of bleeding into the joint. Subacute arthritis, we can get reactive arthritis, that's the post-diarrheal, or gonococcal arthritis, biliaral. Chronic arthritis, again infective can occur, tuberculosis, pyogenic, actomycosis, Hansen's disease, collagen disease like rheumatoid arthritis, crystal arthritis, degenerative arthritis, neuropathic arthritis, hemophilic arthritis. So this is the list of arthritis. So basically remember that depending upon duration, less than 6 weeks, 6 weeks to 3 months, and more than 3 months. That is the first classification that you should remember. The second classification is based on the pathophysiology, whether it is an inflammatory arthritis or non-inflammatory arthritis. By inflammation, the typical ones are the rheumatoid arthritis, the lupus erythematosus, septic arthritis. All these are examples of inflammatory arthritis where there will be signs of inflammation. There will be swelling, redness, pain, and loss of function. Non-inflammatory arthritis are typically mechanical arthritis. The most important and common condition is the rheumatoid arthritis. Overuse and trauma can also lead on to this sort of arthritis. So, first is depending on the duration. Now, depending upon the etiology or the pathophysiology, you have classified into inflammatory arthritis and non-inflammatory arthritis. Inflammatory, the collagen disease is the most important, which are again divided into seropositive, seronegative, infectious arthritis, and crystal-induced arthritis. And various types of collagen diseases will be discussed in detail in another session. So now we go into depending upon the number of arthritis, you divide arthritis into one joint it is called monoarthritis. 2 to 4 joints are affected, it is oligoarthritis, and when more than 4 joints are affected, it is called polyarthritis. So monoarthritis, single one joint, typical example is septic arthritis, crystal induced, that is gouty arthritis. Oligo 2 to 4 can be the spondyloarthritis, reactive arthritis, and inflammatory bowel disease related arthritis. Polyarthritis, more than 4 joints are affected. Typical example is the rheumatoid arthritis. So we have discussed about the various types of arthritis depending upon the duration and depending upon the underlying pathology and depending upon the number of joints affected. The details of each one will be discussed in the next session. So remember this, arthritis basically divided into non-inflammatory and inflammatory. Inflammatory, single joint, monoarthritis, oligoarthritis, polyarthritis. Non-inflammatory, group of conditions are there. So this is and depending upon you can add the duration also, acute less than 6 weeks, subacute 6 weeks to 3 months, and chronic more than 3 months. Next session we'll be discussing about cases and also explain each of these terms. Hope it was useful to you. Thank you. Stay tuned.